The efficacy studies are really quite revealing. All of the vaccines that have gone through phase 3 efficacy trials proved to be 80% or better effective at preventing a lower respiratory tract infection. Now, where are the gaps? The gaps are in really being very precise in our understanding of risk. So we know, and we've known for many years, that age is maybe the single most important risk. But it's not the only risk. And so again, if you're in your mid to late 70s, if you're in your 80s, if you live in a long-term care facility or assisted living facility, I have very little reservation in strongly recommending the RSV vaccines for those folks. But if you're in your 60s, it's worth having a conversation with your provider about that, because not all 60-year-olds are created equal. There are very healthy, very active 60-year-olds who have no underlying medical conditions, and then there are those who are on dialysis with heart failure and with coronary disease and have had heart attacks in the past. And those are the ones for whom we know when you get an RSV infection, it can lead to a serious outcome. And so even if you're only 62 years old, I would still recommend an RSV vaccine for those kinds of patients. And so I think we need to do more studies to really learn, is the 85-year-old with hypertension more at risk than the 62-year-old with heart failure? Are there younger adults in their 40s and 50s who might still be at risk? That has yet to be studied in terms of vaccine efficacy. How do these vaccines work in immunocompromised populations? We don't have that data yet. And of course, coadministration with other seasonal vaccines like the COVID vaccine and the flu vaccine, there's still lots to be learned there. And of course, when you do trials, you're only doing trials in tens of thousands of people. As you give vaccines to millions of people, then you're going to start to see rare side effects. And so these are the things we learned during the COVID pandemic with the COVID vaccines, and there are things that we're going to learn as we deploy RSV vaccines. And I think it's, there's work to be done, but I'm very hopeful for the future.